Good afternoon and welcome to today's CEDA live stream, The Care Economy Battle for Talent. I'm Jarrod, Chief Economist at the Committee for Economic Development of Australia, and it's my pleasure to be hosting today's discussion. CEDA acknowledges that today and every day we are on Aboriginal land. We're committed to recognition and reconciliation, we respect elders and we support their stated aspirations. And in the context of today's conversation and stated aspirations, I note that the Closing the Gap National Agreement seeks to close the gap in life expectancy within a generation, a goal which will be dependent on how the care economy works for Indigenous Australians. CEDA is a leading independent think tank committed to improving the lives of Australians by enabling a dynamic economy and vibrant society. And we do that through independent research and frank debate. We seek to influence policy and collaborate to disrupt for good. Now, to keep up to date on our events, we do encourage you to visit our CEDA website, ceda.com.au. You'll be able to register for all of our upcoming events, but also look back on previous live stream videos. You can also look at a lot of opinion articles, research, all the things that you need to keep up to date on the latest happenings in the economy and policy. And today, like at all of our CEDA public events, you will still be able to interact with speakers through our interactive portal, our Q&A portal called Pigeonhole. It's available via the link below the video on your screen, or you can enter the details by going to ceda.pigeonhole.at and using the passcode Care Economy, all one word. You can also join the conversation on Twitter if you're feeling brave and use today's hashtag, which is hashtag Care Economy, and of course tag CEDA at CEDA_news. Turning to today's topic, we know that healthcare and social assistance is Australia's largest employing industry, with 1 in 7 working Australians, or almost 1.9 million people employed now, up from 1.3 million 10 years ago. And despite this incredible growth, we know that demand for workers continues to outpace supply. Take aged care, where earlier this year, CEDA identified a potential gap of up to 110,000 workers in aged care by 2030. It is evident through CEDA's research that there's no one lever that will solve the battle for talent in the care economy on its own. We need training, migration, wages and conditions, and better career paths all on the table. But it's also clear that employment in this sector is about more than numbers. As a society, we value dignified, quality care when we need it most, but also when those around us are vulnerable as well. And I'm glad to say that we've got a really great panel today, I think, to unpack how we keep building the care workforce we need to deliver the services that the community values so very dearly. We have the Honourable Stuart Robert MP, Federal Minister for Employment, Workforce, Skills, Small and Family Business. We've got Belinda, the Chief Executive Officer of the Community Services Industry Alliance, and Paula Williscroft, the Director of People and Culture at the Northern Sydney Local Health District of New South Wales Health. I won't read their bios, they're on the website. We're going to hear from each of our speakers and then we're going to have about 30 minutes of question and answers. So as I always say, get in early and often on the Q&A portal Pigeonhole, get those questions in, vote for other people's questions, and we will make sure that we finish up by 1 p.m. Today. That has not changed in the virtual environment for CEDA events, finishing on time. So now I'd like to hand over to our first speaker, the Federal Minister for Employment, Workforce, Skills, Small and Family Business, the Honourable Stuart Robert MP. Over to you, Minister.
Thanks, Jarrod. Good to join you. For those who've read the aged care, the report from the Aged Care Royal Commission, have seen the growth in the NDIS, and I've looked at the intergenerational report recently released by the Treasurer. They are all sobering reading. What they tell us is that going forward, we'll need more nurses, more aged care workers, more disability support care workers, and perhaps less lawyers. We also need to celebrate our workers. We need to celebrate the care industry and see it as a vital care sector. As I always tell my departments, if service is beneath you, leadership is beyond you. And the service industry is one that is set to strongly grow. Data from the National Skills Commission shows us that by 2025, we'll need another million workforce. Of that, a quarter will be in this service or care space. Indeed, aged care is one of the fastest growing segments of the market, given our nation's ageing population and, of course, the NDIS rollout. But forecasts show that workforce numbers in this sector will still need to grow strongly. And as Jarrod, you've pointed out, CEDA's recommendation or their projections of 110,000 short over the next decade in the aged sector alone. The 2018 task force highlighted numbers of challenges that we need to overcome collectively as a country. High employee turnover, difficulty in attractive talent, undervalued jobs with very poor market positioning. There's a casualisation of this workforce, particularly in home-based care, and ineffective recruitment, induction and onboarding. And these challenges are amplified outside of our major urban areas. Now, the government is well attuned to these challenges, hence myself as the first workforce minister for the Commonwealth to start looking at these and many others, as well as deciding at a government level to start putting serious resources behind them. To give an idea, out of response to the Aged Care Royal Commission, we're investing $652 million to grow, train and upskill just the aged care workforce. This is part of the $17.7 billion package at reforming aged care. These are extraordinarily high numbers. So we will fight for this workforce because we know it's needed and we know we need to respond now. We're driving forward efforts to connect with Australians who haven't actually considered a career in the care workforce, with specific initiatives that are already beginning to turn the dial. Our Jobs Fair program that's enabling employers from the care support industry to connect with staff in the areas of need. Our local jobs program is providing on-the-ground presence in communities, connecting job seekers with employment opportunities. We've created the Local Recovery Fund, which is supporting small-scale initiatives aimed at getting people in the regions into jobs. Our $2 billion Job Trainer program is another important initiative combined with the states and territories to help identify and meet skills shortages. Working in partnership with states and territories, it provides free or low-fee training for young people entering the workforce. We've seen 27,000 new Australians at 31st of August enrol through Job Trainer into the care workforce. And indeed, in the May budget, we doubled down and provided funding for a further 33,800 places for Australians to do an approved aged care course. Likewise, Job Trainer is funding programs like the Entry into Care Roles, which is a wonderful initiative that allows Australians to do a number of core competencies in aged care and disability as an entry-level set, and they can then work further and do more modules to get a Cert 3 over time. $3.9 billion in our Boosting the Apprenticeship Commencement Wage Subsidy has seen thousands of Australians enter into the care industry. Likewise, we announced last week $716 million in the completing the apprenticeship commencements to ensure those Australians that have started in that program continue to do it. We'll continue to provide more bones behind those initiatives. We'll continue to boost those initiatives to ensure we can get the placements we need. This is one of the roles of Workforce as a ministry to ensure we are well prepared for the needs we are going to face. Oh, goodness. And I should have noted, Belinda, it's now your turn. Over to you, ma'am.
Thank you so much, Minister. Thank you. I was going to be impolite and jump in there if you
you should have.
I'd also like to begin this afternoon by acknowledging the traditional lands of the people I'm meeting with you from, the Yagara and Turrbal people, and pay my respects to elders past, present and future. Thanks to CEDA for having me here this afternoon. Hopefully I can build upon some of what the ministers just referenced. Certainly lots of my comments today build upon CEDA's recently released report, Duty of Care, Meeting the Aged Care Workforce Challenges. The perspective I'm coming from to you this afternoon, though, is from across the whole breadth of community services. That includes disability and aged care workforce, very fast-growing workforces, as the Minister has referenced, but beyond that to workers working in child protection, in domestic and family violence, in homelessness services, etc. So first off, I just wanted to speak to some of the sort of structural issues I think that challenge the community services industry in this space, which relate to labour market dynamics. We are a really highly feminised workforce. As many of you will know, about 75% of our workforce is female, and that workforce is ageing. It's on average between 45 and 50 years of age. This brings lots and lots of benefits to the people that we work with on a day-to-day basis, but we must continue to challenge ourselves to improve gender balance, really in the interest of the people that we serve. And this is this is quite stark in the disability space, I think, as people exercise choice and control over who they would like in their lives working with them. We really need to get to a place where we start to understand more about labour market mobility in the interests of really trying to address some of the really critical skills shortages, workforce shortages in regional and remote locations across Australia, and certainly here in the state that I work in, Queensland. We need to focus more on these issues of underemployment and casualisation across our labour force, and to the points raised really well in the duty of care report on pay and conditions. And also to, I think, start thinking hard on planning for a workforce that's able to cope in an increasingly digitising economy. And for our industry, I think fair to say, in many ways, COVID has brought an extraordinary acceleration of digitisation, but we need to do much more. So these issues then are inextricably linked really to my next set of points on workforce development. And it's fantastic to hear the Minister talk about the focus of his efforts in that workforce development space, because across the community services industry, we think this is critical to our future. So focusing in on modernising workforce development practices, including retention and recruitment, is absolutely critical. More and more we need to be recruiting for the people that we're working with, not just for the roles that they're in. And in this, really picking up again the Minister's point about celebrating the central focus of this workforce on changing the lives of people for the better, and bringing professional identity around that and professional development to support them. So really to my last sort of points, there's significant investment already in the system in skilling and employment programs, although, you know, comments have already been made about increasing that investment, which is very welcome. There's some effort in that system at brokerage between employment and skilling programs, and some of this happens at a local level. We think, however, that it's critical that this local level brokerage is amplified across three main dimensions. One, we need to do more local level planning that brings skilling programs, training programs, and employment programs together, and in the context of building actual plans on the ground. We need to focus in, secondly, on industry-specific strategies, that where there are generic programs or programs predominantly focused on other industries, that they're pulled towards the interests of the care and support sector, and that critically they're led by employers and employer interests. That we finally need a set of cross-industry strategies that help us to get beyond our own interests to some of the interests that lie across various sectors and industries. And for example, bringing together community services, health, retail, hospitality and tourism to work together, I think in this space, particularly on issues of underemployment and casualisation. So to conclude, the increasing demand for workforce in our industry is actually taken for granted now. It's understood, it's well understood. Will continue to grow significantly over the next 5 years, and the Minister has pointed the numbers on that are really very significant. So this growth in demand for workforce, in combination with the impacts of COVID on the labour market, on demand for great workers, is really the perfect opportunity to act. And we must do this with people who we serve every day at the centre of our concerns. Thanks so much for listening, and I'll pass over now to Paula.
Thank you, Belinda. Thank you very much, CEDA, for inviting me to participate today. And I too would like to acknowledge the lands upon which we're all meeting here today and pay my respects to elders past, present and emerging. I want to provide a little snapshot in time in terms of what's happening in the acute sector here in New South Wales, particularly in Northern Sydney Local Health District. I welcome the investment at federal and state level in terms of what workforce planning and what our strategies for the future look like. And I certainly feel that our experience has echoes of some of the challenges that Belinda has outlined already today. So I'd like to just provide you with a little bit of context in terms of who Northern Sydney are and how we've been navigating the pandemic over the last couple of years and how that shapes our thinking in terms of the challenges for workforce for the future. So if I could have the next slide, please. So what do we look like? We look after 5 hospitals, including Royal North Shore, which is our largest hospital, employing around about 4,500 employees. It's our principal tertiary referral and teaching hospital. Royal North Shore provides a range of statewide services that I won't list, but you can see on the screen here, as well as running acute medical, surgical, mental health, paediatric, cancer and maternity services. We also partner closely with the University of Sydney. We have a robust Colling Institute research program and innovation in that space. Overall, as a district across our 5 hospitals and our community-based services, we employ 11,000 individuals, 80 of which are female, 50% of our workforce in total are nurses, 15% work part-time, 25% speak at least one other language other than English outside of work. And as Belinda has said, like aged care and disability services, we have an ageing workforce caring for an ageing population, and that brings with it its own opportunities and challenges. So if we could have the next slide, please. So just to give you a snapshot into some of the things that we've been navigating, I'd say that while we're trying to constantly look at forward-thinking horizons in terms of what's the impact on workforce planning, workforce strategy, we've been very much working in tactical response mode over the last couple of years. Our first sort of journey in terms of the pandemic started in February 2020 with Ryde Hospital and a couple of the aged care facilities within our jurisdiction that had the first community-based cases. And some of the initiatives that we had to do is, as well as immediately responding to that, which was very new and uncharted territory for us all, sort of flowed out of that. We, as a system across New South Wales, as other states have done, moved very quickly into planning for surge for ICU services, which included, identifying additional staff, reskilling equipment and capacity building in that space. We then introduced additional COVID-related services, so testing clinics, bricks and mortar, but also pop-up facilities to be able to agilely move to where outbreaks were occurring and continue to occur. Supporting a workforce that was providing airport screening services into Sydney. And also managing local outbreaks. So we got through to the end of 2020 thinking this was the year that was, and suddenly realised that we were going to continue into 2021 managing the pandemic is very much part of our service delivery. So what that's meant as we've managed through the last year is an ongoing requirement to be quite flexible and agile in the workforce, managing workforce exposure, isolation events where we have a proportion up to 1% of the workforce that might be in furlough at any one time, continuing to maintain specific identified services such as the rollout of vaccination through hubs, obviously managing the New South Wales outbreak, which has been the longest lockdown period for New South Wales to date. And also, as a district, we've been fortunate to be able to support our statewide response to regional rural issues as they've emerged, and also some of the statewide emergency operations such as contact tracing and special health accommodation for community members that are unable to isolate safely at home. And then now we're turning our attention really just to turning services back on, elective surgery, breast screen, oral health, community services, and leveraging telehealth as we go through into 2022. Next slide, please. Thank you. So what does this mean for us? Well, I won't go through this in a lot of detail, but extensive initiatives in terms of finding staff, predominantly nurses, as we've already talked about, both using our existing capability, looking at agencies, constantly recruiting, and moving towards new models of care where we're not relying just on registered nurses, and looking at a multidisciplinary approach and students being part of the workforce on an ongoing basis. So next slide, please. So what does this mean in terms of opening up? Well, where I think the challenges are going to come for us from a workforce strategy point of view is that the levels of activity we will see will create a new baseline. And by that, what we're seeing overseas and certainly beginning to emerge is that we have a level of activity coming back into our hospitals that we will need to manage on top of a baseline of ongoing COVID activity. So we'll still have some admissions, we'll still have some COVID patients that we need to accommodate in ICU. The acuity we're seeing, particularly on non-COVID ICU patients, is quite high. And also we're going to need to continue to be agile as a workforce, which presents its own challenges. And what remains to be seen at the moment is what the implications will be for us and the role we'll need to take in rolling out any potential booster program. So final slide, please. So my thinking at the moment in terms of our future workforce strategy, it falls into 5 key areas. One is recovery, which I'm happy to unpack further, and that's really around well-being and ensuring the workforce feels safe, the implications of not having that in place, not reinforcing that. Resilience, allowing people to take a break. We're going into a continued busy time, although the landscape is different. And we have growing amounts of excess leave across the industry, and people are tired, potentially burning out. Reinvention really relates to models of care and closer collaboration, as Belinda has touched on. I think there's a whole of system solution or set of solutions to some of the problems that we have in terms of workforce. And then finally, recruitment and retention. I think, again, looking at the domestic and international student environment and what's happening there, looking at the number of people who are now interested in coming into the care sector and those who've decided that they've had enough of dealing with the pandemic and may choose to leave. So, these are issues that are going to emerge over the coming weeks, months, and potentially next couple of years. We see what the implication is of our training and education pathways. So thank you very much for giving me an opportunity to provide you a little bit of an insight into where we're at in Northern Sydney, in New South Wales, and I'd like to hand back to Jarrod.
Well, thank you for that, Paula, and for all the work done in the Northern Sydney Local Health District. A really, really critical time, obviously, at the moment. So I wanted to start some questions. We do have some questions coming through on Pigeonhole, which is great. I'd like to see more. I'd always like to see more questions on Pigeonhole. So please keep them coming in and keep voting. But I do want to start with a question to you, Belinda. You've mentioned the issue around casualisation, and I think one of the things that we really struggled with a little bit, to be honest, when we did our aged care report, was the fact that there are a lot of people looking for more hours, yet we've got this issue around a shortage of workers. Do you have any thoughts on what's driving the kind of issue around casualisation? Is it around the need for, surge demand and being able to meet that, or is there something deeper here in terms of why we see casualisation, particularly in the caring sectors?
Thanks, Jarrod. Look, I think there's a range of issues. One of them, particularly in, I guess, the disability and aged care sector, there are some issues related to casualisation that are about the funding mechanisms and the business models that organisations operate within. So to make that really, concrete, in some instances, if a person with a disability needs to access care and support for them, and based on their preferences, they might not have full-time hours to offer. Workers are attached to particular individuals in terms of the support that they provide and prioritised for supporting those individuals. And so that sort of sets up, I guess, some structural rostering issues. So I think there's definitely, some constraints there, but they're things I think that could be overcome in planning. I think the other thing that drives it are potentially as well the preferences of workers themselves. So it is true to say across our industry that some of the work and the work hours are actually chosen by some of those workers for the purposes of flexibility. So casual roles are suited. Whether they're suited then in the long term, I think is the real question to ask. So a worker comes into a casual role because it suits them in the first instance. 3, 4, 5, 6 years later, they may very well have shifted in their preferences, but their work arrangements may not have. So I think, again, there's some planning work to do there. The final point I guess I'd like to just make in that space is I think this is where there is, as I said, enormous opportunity to do some cross-industry work. So as to deal with those casual and underemployment issues collectively rather than organisations trying to struggle away with those on their own. So again, if an organisation can't provide extra hours to a worker, perhaps other organisations or indeed other industries could to build up full-time roles. And I guess bringing those sectors or industries together to try to address some of those issues collectively and cooperating rather than competing on labour, I think is something we really need to think hard on. Thanks.
Thanks, Belinda. And might turn to you for a question, Minister. You made a really important point, I think, in your opening comments around just the importance of a workforce minister at the federal level, and I guess having more of that high level view of what's going on. One of the things that our members often say to us is that there's often circular economies of talent going on within Australia where people are churning through the same kind of sectors. And this is obviously an area where we're concerned about that around not growing the whole kind of caring workforce, but having people churning across sectors. How are you seeing that challenge, and I guess keeping some of the players and state governments and others accountable for growing the whole workforce as opposed to having people going between different parts of the caring sector?
If we step back one economically, you've got to have an environment where people are free to choose. Free democracy, if people wish to move seamlessly through and have a change in terms of their career, superb. But the only way we're going to do that is to have a workforce that's growing. The economic term is the non-accelerating inflation rate of unemployment. At what point is the unemployment rate where there's work for everyone, you can seamlessly move across, but doesn't have an inflationary aspect? That number is somewhere between 3.9 and 4.5%. Now, we saw the latest unemployment at 4.5, but that's because the participation rate had collapsed. But the month before that, it was 4.6. Bottom line, Australia is the only country in the OECD with more of its citizens employed now than any other comparable OECD country pre-COVID, which is superb. It goes into play of what the government's policy provisions have been. But we're in a real problem now because with our borders closed, we normally would have had about 400,000 net overseas migrants come through. 30% of those would be skilled. Now, it's all skilled migration, but skilled migration means the primary visa holder plus generally spouse and children. And it's those spouse and children that come and fill some of the lower technologically required roles, many of them hospitality and service roles. So we're short 400,000. We're short a couple 100,000 students, backpacker visas, short stay visas. So we're probably short 600,000 workers that we would have had now, but for COVID. And at the same time, the last couple of years, about 400,000 workers have left. They've passed away, they've got ill, or they've simply retired. We are short about 1 million warm bodies. So the skills crisis is about to crunch very, very hard. And the issue won't be, hey, there are people swapping and moving between various sectors. It's going to be, we've got a real struggle with finding warm bodies to fill roles. Same time, 700,000 Australians on payment in terms of job seeker. We've got to give the opportunity for those Australians to work, but also lots of vulnerabilities and challenges there. Hence the need for a workforce minister at a cabinet level to start to thread some of these needles, dealing with the big macro challenges first. How do we get international borders open? How do we get workforces? How do we get skilled migration back again? How do we ensure our mutual obligations and our new employment services models encourages those Australians unemployed to work? And then how we thread those needles to ensure we get a balance. Not for the faint-hearted, Jarrod.
Not at all, Minister. Some sobering facts there, and have to agree with you with the coming skills and labour issue crunch, as I think you describe it, that we will see. Paula, I want to come to you specifically on the impact of COVID on the health sector. We obviously know that demand for workers has increased both in the short term and probably the long term as well. How has it affected attraction into the health workforce? Are people seeing this as an opportunity to get involved and to serve, or are they kind of a little bit anxious about joining the sector amid a pandemic?
Thanks, Jarrod. It's very mixed at the moment, and I think we need to have a look at the data as it's emerging quite closely now to see what the Australian picture is. Within our existing workforce, I've been overwhelmed every day for 2 years in terms of the number of people prepared to step up, continue to work really, really hard. I think it's fair to say, in terms of our experience, we're all fishing in the same pool in terms of recruiting from within our existing labour pool, whether it's New South Wales or across Australia. I echo the Minister's concerns about the external supply of workforce coming through from either international students or migrants. That will start to have an immediate impact on us, I think, in terms of the as we go into 2022 and 23, in terms of what we would normally be expecting in terms of nursing graduates, for example. But I think what I'm not clear about at the moment is what's the national and state level of attraction in terms of internal enrolments at the university and TAFE level looking like. Anecdotally, the universities that we work with seem to be mixed. Some are filling their capacity for their nursing enrolments. Others are down by about 25%, which is similar to what the US are experiencing. We're not seeing attrition significantly, and I think that's partly because people have been, obviously employed in health and care, and during the last couple of years that's been very important for people to maintain job security. So I think it's a very difficult question to answer definitively, but we will be, over the next few weeks and months, I think we will start to see a picture emerge that is pertinent to the Australian story.
Thanks, Paula. I am going to go to the questions on Pigeonhole because they are starting to mount up, and I'm going to come to you first, Belinda, and then back to the Minister for a question on aged care. Belinda, we've got a question here around there's an abundance of options to upskill and train, and the Minister's mentioned job trainer, for example. But the question is, how do we support that investment in other critical areas, including pay, including work placement, and even time for staff to partake in training? What do you think is required to kind of get that investment on that side going to support the training?
So I think it's a great question, Jarrod, and I think there's absolutely no doubt it's fair and right to say that a highly skilled workforce in the care and support sector is absolutely necessary, alongside making sure that we go in pursuit of recruitment practices that get the right people into those roles. But I think employers need to come to the fore in this space and start to become kind of more active in answering some of those questions around what it would take to frame an approach that would help them to support people successfully into roles, post-training and indeed, as you say, during training. So there's some great examples emerging across Australia now in aged care in the next little while, we hope, and also in other sectors where there are basically subsidies put in place to support people to train on the job. There are also, subsidies put in place to release people in order to go and do training. But I think alongside that investment, both in the training and in any subsidy to help release people to do training and provide training support, we also think it's really important that people get access to ongoing high quality support and mentoring into those first few years in their role, because as the Minister rightly points out, if we go to all of the trouble of getting these people into these roles, then what we really need to do is make sure once they're skilled and ready to do the work that they stay with us in the longer term. So our assessment is really that those investments at that front end are relatively modest, but really, really impactful in the long term in terms of retention and really, about, I guess, making sure we can get the full benefit of training that people receive as they approach the industry to do the work that we need them to do. Thanks.
Thanks, Belinda. Minister, for you, the top question at the moment from Helen Kemp has kind of double the votes of anything else, asking what the government's position is going to be on the wage rate for the aged care workforce. Is there any comment you'd like to make on that one?
Not that's well informed or briefed. The aged care minister, which comes under the health minister, is responsible in that respect. And as you know, most of these are set by the Fair Work Commission independently of government anyway, so I wouldn't have anything to add on top of that.
All right, I might stick with you with a question that is more within your purview. We have one from Yasmin King, and she's concerned about the fact that there's poor practice in the delivery of training across the care sector, and how we kind of deal with, on the one hand, that we do need to get things moving quickly and do need to get more people through training, but we don't want that to be at the expense of quality. What's your view around some of the things that the government is doing on that?
There's an independent regulator, ASQA, that goes through and determines the quality of what training is and how it's being delivered. There'll be announcements very shortly about how we're going to change how qualifications are built, because currently it takes 2.5 years to update qualifications. It's completely unacceptable. The way qualifications are constructed and competencies designed is not fit for purpose. So there'll be substantial changes coming through, building on our skills organisation pilots we've been running for the last 2 years. So we can get qualifications built, updated within 90 days and get that happening very, very quickly. And we'll leave the regulator to determine the quality of training. Everyone's got a view when it comes to training and how it's delivered and how it's not. We'll let the regulator deal with that. We'll make the point, though, that TAFE delivers only 18% of our training across the board, yet gets 72% of all state and territory and Commonwealth funds. But the private RTOs, registered training organisations, are delivering 82% of training. So there's also a mishmash in that space. But the regulator's job is to ensure that the training is fit for purpose, and the changes we'll make in how qualifications are being built and designed, led by industry for industry, will also make a substantial difference.
Thanks, Minister. Paula, I want to come to you with a question from Michael, and he's asking about how the sector can better integrate technology and talking about wearables and robotics and remote care. And obviously we saw some examples, and I assume that they're still ongoing in the New South Wales health system, of doing things differently and perhaps using technology more than we would have in the past in terms of care. How have you seen things shift a little bit during COVID out of necessity, and what are you seeing kind of longer term based on those experiences, whether there's going to be more sort of appetite to try those things?
The short answer is yes. I think we've taken a few steps, and COVID has certainly accelerated that in a fantastic way. We've, I think the quote I've heard time and time again is we achieved in the first 6 months of 2020 what was going to take us 5 or 6 years in terms of an ICT strategy. Telehealth has been a key feature of that. AI and wearable technology is probably still in its relative infancy and discovery stages, but it's certainly an opportunity for the future. I think there's two issues to this, and I think Belinda touched on this earlier. One is the digital literacy of our workforces across the whole sector, and we need to be looking at that and integrating that into our training pathways and our employer-driven CPD pathways now in anticipation of what that will look like. But also, I think there is a big opportunity here for the interface between aged care, acute care, public health, primary health, and disability services and other services. And it's about using technology and using really smart workforce strategies to leverage the prevention, avoidance, and early discharge strategy. So really looking at integrated care in the best possible way. And the reason why I mention that is because the technology and the workforce are going to continue to cost a lot of money. But we need to look at how can we cleverly redistribute our resources across federal and state-run services to be able to achieve the outcomes we want, both in terms of our patient care and community care and experience of the community that we serve, but also in sustaining the workforce with the skill sets that we need, with all the challenges that we've already described. So technology is absolutely part of the puzzle, but it also should be within the context of an integrated care strategy.
Thanks for that, Paula. I've got another question here. I'm going to come to you, Belinda. And talking about the fact that obviously people want to stay at home as they age, and the challenges and opportunities in terms of specifically the home care workforce that we have in aged care. Obviously, there was considerable investment in the budget here to try and boost home care. But what are the specific challenges that you see in terms of the conditions and the nature of providing home care, and how we get the right workforce into home care specifically?
Look, I mean, I think one of the tricks here again is to look to adjacent areas across the industry to see where that's been done and done well. And there are many examples of it, including in the area of disability support, where care has been provided, or support has been provided in the context of people's homes for decades now, really. I think there's some preference, some choosing that goes on here at the workforce level between residential settings, centre-based settings, and home care settings. So I think, again, this sort of points us back to some more sophisticated, nuanced recruitment and selection approaches that help us to discern those people who are best placed to do that work. I think, of course, very obvious thing to say, but that work can be, isolating. So employers need to think, very carefully about the sorts of conditions they're setting up, make sure that they, setting up the best possible safe workplace they can in the context of people's homes, balanced against that idea that, this is the very private space of people, and that we need to approach those services and supports with that thought in mind and respect people's place. So I think, there's lots and lots of models and approaches already across the industry that we could draw on across into the aged care setting, and indeed many, many great examples across the industry itself of that work being delivered well. I guess I'm a big fan of not trying to reinvent the wheel, but build on the models that are working, amplify those across the industry.
Thanks, Belinda. I'm going to come to the Minister on this next question, really, I guess, a kind of structural labour market question from Matt, who asks, how can healthcare and social assistance industry compete for workers when increasing wages is not the easy option that it might be in other sectors? But perhaps if I could broaden that question out a little bit further as well, Minister, would you like to see a kind of broader campaign around really boosting the kind of prominence and role of the care sector in terms of jobs and trying to attract people into it to kind of overcome some of those things that aren't changed as easily perhaps in the sector?
Funnily enough, there will be a substantial government campaign on doing exactly that, which is about looking at the salience, how people view the care sector, and just promoting it at the right level of what it should be, that it's a privilege to serve Australians and that there are lots and lots of opportunities and there's lots of training opportunities. At the same time, we have to make sure that the entire education ecosystem works, and at present, frankly, it doesn't. Right now, if you do a skill set, you do units of competencies, they're in a vertical. If you wish to do another unit of competency, you have to do the same vertical. We'll have announcements soon in terms of how we're going to do qualifications. The next structure is to move away from units of competency per verticals on 1,200 plus qualifications. And how do we build a qualification library, a unit of competency library? Not just accredited units, but also units that industry is doing, that universities are doing, micro courses and short courses, bring it in, and then allow new qualifications to be built, new courses to be built, and importantly, leverage some of the great tech we've got to say, hey, Jarrod, you've done these 23 units of competency for a Cert 3 in individual care and a Cert 3 in X, in aged care. If you do these other 3 at a RTO 5 kilometres down the road, you'll also be able to get this qualification that opens up these job opportunities. That's the tech we're going to be building from December, about connecting the National Careers Institute in, so to widen the qualifications that Australians can have by recognising the skills, training and knowledge they've already achieved or they've already trained in, and then connecting that into career advice. Because most people, of course, only get career advice when they're at a student at school. The National Careers Institute is about broadening that, widening that, because recognising we're all lifetime learners. That's going to turn the dial. Because right now, no one is saying to Australians, hey, do those extra 3 courses, you're qualified in X, and here is the roles available to you. We're now at a point technologically where we can do all that, and that'll make a substantial difference.
Thanks, Minister. An interesting question here on the Q&A portal is around what are the things that people would like to see other than workforce change in the care sector. But I might ask that a different way to you, Paula, in terms of are there non-workforce things happening in the sector that you think could have a really positive impact in terms of the workforce, both in terms of attraction and retention in the health workforce?
Look, I think the innovation that is happening and the diversity of opportunity for people, I think we need to be celebrating more and we need to be talking about more. There are lots of different career pathways that people can take coming into our sectors. There's a lot of fantastic work and innovation in terms of service delivery. There's a lot of increased focus in areas which perhaps have not had the investment historically and now has because of growth in demand. So Belinda mentioned domestic violence, child protection. I'll throw mental health in there as well at the moment. This is a time where we have an opportunity to really meet our social obligations to our community and to help them. And this is pre-COVID issues that have been, emerging as we know. COVID has amplified some of these, obviously. So I think there is some There's some messaging to be had here around individuals who want to work to give back, who want to serve, who want to join organisations that are for purpose, whether they're for profit as well or public sector, but are providing support to Australians. Diversity of work, job satisfaction and innovation, I think, are probably the key things.
Thanks, Paula. And Belinda, a question for you. The Minister talked about it in his opening remarks, just the kind of amplified nature of these issues of care workforce within regional areas. We haven't spoken specifically about that today. How do you see some of those challenges and the kind of specific programs or focus that we need into regional areas to make the workforce, sustainable there?
Pointing back at some of the comments of the Minister made about overseas work, skilled labour, etc. I mean, all of those things are necessary from a supply point of view, but beyond that, some of the things we've seen work really effectively go to the comments I made about local level planning. So I think, Minister, you referenced before that idea of the sort of skills and employment ecosystems and intervening in those at a local level with players on the ground at a really, really practical, with a really practical focus rather. So we have been involved across the last number of years in disability workforce work where we've worked in regional Queensland focused at that local level, bringing that ecosystem together. And those people come together to actually plan for issues of attraction, skilling, support and retention over time. And I think that's so important because, certainly emerging in many Queensland regions, I'm no doubt it will be the same across Australia, all sorts of other issues related to where these workers live. So, supply of housing for them, together with issues about where their kids go to school, if they have kids, et cetera, et cetera. So those issues can only really be kind of addressed at that highly localised level. So, we think that's absolutely critical and we've seen some success in that. I think the other thing in that is it gives us an opportunity as well, to work through those settings across the business sector. And that's something that we're really keen on seeing happen more, is that kind of reaching beyond the care and support sector to see what the private sector can contribute as we kind of move through these challenges. We can't do it all on our own. So, yeah, but I think that local level regional planning is really critical.
Thanks, Belinda. And I might leave the last question for the Minister. We've got a question here that from Anonymous sort of expresses a little bit of frustration about the fact that some of the issues in aged care have been known for a long time, but that the sector hadn't engaged in workforce planning. I guess a question for you, Minister, around how do you see workforce planning? Is that something that you really see as a responsibility for industry to coordinate and bodies like the National Skills Commission and the government can publish data that sort of points to trends and things that people need to consider? Where do you see that a role for workforce planning and where that's best sort of, who's got responsibility and accountability for that?
The answer will come depending upon who you ask. I think that government is not the answer to most questions. It has a role to play. So I would suggest that a lot of workforce planning needs to happen at the local level, as close to the ground as you possibly can. There are those who believe that government is the answer to all questions and therefore government should do it all. So it depends where in the spectrum you sit. As the Workforce Minister, my job is simply to, if you like, be the conductor. So if I look at a musical score of 10 or 20 different line items to make sure they're all being addressed and they're all pointing in the right direction, to make sure our immigration settings and our immigration numbers are lining up with our skilled settings and our qualifications frameworks, that our university courses are lining up with our vocational courses, the way we build qualifications and skill sets is meeting the needs we have, that our registered training organisations privately as well as our TAFEs publicly are actually operating at a level that is productive to drive state governments and local councils to approve especially facilities and training facilities. It's no good having a great training requirement if a local council won't approve RTOs to develop. So taking a 10,000-foot view to try and get as much alignment across those as possible is what I've got to do as the Workforce Minister, and then start to identify what are the things that are prohibiting us that need to go. What are the requirements from the National Skills Commission that outlines the priorities? Are we putting enough public funds into training those priorities? Are the training that's coming out of our training institutions, are they training the right people in the right places for it? Or are we teaching basket weaving and rooftop gardening where there's no demand for it? There's 1,270 odd accredited training courses. The top 500 is 97% of all students. So that means the bottom 500, there's no one doing any of it. So why is there public organisations that are teach it up, resourced up, ready to teach 500 courses that zero people are doing? It's about getting the system as a whole to be focused on what the country needs as a whole, but the private sector has got to lean in very, very strongly as part of this. And if we do that, I think we'll be fine. If we don't do it, I think we'll be in trouble.
Well, Minister, I think that's a good note to end the discussion on. I'd like to thank you and Belinda and Paula for your participation and contribution to the discussion today. Cue virtual clapping. I'd also like to remind everyone viewing this to take a moment to rate their experience in Pigeonhole, and please keep a lookout for the post-event email, which will include a link to today's live stream recording. Please, as I said at the start, stay in touch with what we're doing on the website, ceda.com.au, and you will find there the CEDA report duty of care that people have referenced today as well, if you want to have a look at that. You'll also see that we've got some great upcoming live streams. Tomorrow we have the pathways towards net zero with the Federal Minister there as well. And on the 26th of October, we've got empowering First Nations people with a focus on housing. So continuing live streams, fantastic events coming up. Please stay tuned. Again, thanks to everyone for tuning in today and to our panel. And until next time, please go well.